I'm Dr. Saranya. I'm a pediatric dentist practicing in Bangalore. Today, I would like to try and highlight a few important points that you can use to keep your child's teeth healthy. Now, what is the first thing that comes to your mind when you think about teeth? Brushing. So, when do you actually start cleaning your child's teeth? You have to start cleaning even before the first tooth comes in. There are gum pads that are there in your child's mouth which need to be wiped off with a soft muslin cloth and plain water. This will make sure that there is no bacteria build up when the first tooth comes in, especially when the child is teething and the child can put a lot of things in their mouth which can carry bacteria from the outside to the inside. After this, when the first tooth comes in, you can move on to a finger brush, which is a silicone brush that you can wear on your finger and use a non-fluoridated toothpaste to clean away all the germs that are there on the tooth. As the child grows, you can move on to a baby toothbrush and an age-appropriate toothpaste and continue brushing. And when the child is around 6 years, you can move on to an adult toothpaste, but a very small quantity, like a rice grain quantity of toothpaste to brush your child's teeth. The second concern that comes across is, do you need to floss your child's teeth? Normally, the baby teeth have a lot of gaps in between them and you do not need to floss. But if you feel that the child's teeth are irregular or they're placed too close together, then sometimes we do advise to start flossing when the child is around 4 or 5 years of age or when the permanent teeth start coming in. This will make sure that there is no germs build up in between teeth that can cause cavities. Now, what causes these cavities? It is common knowledge that the more sugar a child consumes, the more snacks a child consumes, the risk for cavity increases. Yes, that is true, but that is not the only point. So, added sugar in the form of sugar in milk or when the baby is transitioning from breastfeeding to bottle feeding, this of course increases the risk for decay, but this is not the only concern. You also have to consider how frequently the child is consuming this sugar or how frequently the child is snacking. Increase in frequency. So in between meal times, if the child is taking too much of snacks, the risk for decay increases. Or if the child is used to keeping food in the mouth for a really long time before swallowing, again the risk for decay is very high because the food stays in contact with the teeth for such a long time, it gets stuck there and it increases bacteria buildup which can speed up the chances of decay. So apart from this, what do you look for in the teeth? How do you know if your child has decay or not? So start looking for any bright white spots on teeth. Bright white spots or brown spots are the very first signs of decay. At this stage, your child is never going to tell you that there is pain or there is sensitivity. These symptoms don't come very easily in a child. So you have to consciously look at the child's teeth and note down if any such spots are present. These can be on the surface, on the biting surface, in between teeth, just about anywhere. If you notice any of these spots, just visit a pediatric dentist. There are a lot of preventive procedures that we can do to make sure that the cavity does not progress. Now, the next big question, when do you actually see a dentist? So, the first dental visit for any child has to happen when the first tooth erupts or around the first birthday of the child. This is not a treatment visit, it is just a visit more for the parent than the child. We try to tell you, we try to guide you on how to brush, how to keep the child's teeth healthy. It is very hard to start brushing in an infant. We just try to make the process a little simpler. So the sooner you check, note for decay, do all the preventive procedures and visit a dentist, the whole process of keeping your child's mouth healthy becomes easier.